Friends, hope you're doing well. So today I'm going to talk about a long-standing debate, that is MD versus DNB versus Diploma. So after NICT and NEET PG results, a lot of students are confused about whether to prefer branch or a degree. And yes, definitely it's a confusing question. So today I'm not going to do a very conventional kind of video. Here I am going to give you also a reality check and also going to tell you what is the wise choice considering the current scenario of a health system that we have. So let's talk about it. So I want to share with you my experience. So I have worked in a tertiary care center in India, Designs Delhi, IIMS Bhopal. I have also worked in a private hospital. I have worked in a state college and I have also done my private OPD practice. I also was fortunate enough to have very qualified people around me. I have friends who have completed their MD and DNB from all parts of India. So what I'm going to share with you is my experience till now, and what are the, if you want to establish yourself as a doctor, then how these things are going to affect. So along with MD, DNB and diploma debate, I will also give you a few practical advices. So first I want to tell you about the current scenario of healthcare. Right now you have completed your MBBS and you want to pursue MD, and after that you will see to establish yourself. So just want to, as I have already done my MD, I'm going to tell you few scenarios that are there. First of all, growing competition. So we have, as we say, like I noted one comment, like recently I got one comment about, every branch feels saturated, that, all say that all branches are getting saturated. Actually, this is partially true. At one side we say that India needs a lot of doctor, and one side we say that, the branches are saturated. The reason being, all doctors are concentrated in cities. Like all doctors, they, like, especially I mean MBBS doctors, like post MBBS, post MD doctors, everybody wants to practice in metro cities and major cities in search of a good quality of life. So that is the reason the cities are mainly saturated and they mainly are concentrated with the doctors. So that is one thing. Second is entry of a private players. So initially the hospitals were majorly run by doctors, all the trust or some big corporate hospitals. But now you must have seen the ad of like Pristine Care and all on the television. So these are the lot of non-medical private players that they are hiring doctors and running. So that is also bringing a lot of competition. Also post-COVID shift of mindset. So there is definitely a post-COVID shift of mindset in the minds of the patients, that how to their approach toward the doctors, because media very differently portrayed doctors in front of people post COVID. At one time we were held as a hero, but later we had a different kind of opinion from the people. So that is also there. Also unseen competition. So when I say unseen competition, is actually we just think about other MD graduates and DNB graduates, but we have to also look for those who are BMS, BHMS and other other people who are practicing the alternate medical streams. So they are also practicing as a child specialist, diabetes specialist and all. So being a MBBS and MD, you don't have competition only from your own fraternity, but also from the alternate medical streams. So that is also why I'm telling you this. It will make sense in a while. So first, just to make this video interesting, let's talk about a little bit of history. So you'll see why I'm discussing this. Just 2 lines. See, MCI was established in 1934 to regulate the medical system in India. So this is very interesting. You'll be like to know that this was established to regulate the medical system, to establish the MDMS and all this postgraduate system. NB on the contrary, which gives the degree of DNB, which was established in 1982. It was actually established to uplift the medical education, and this was to actually increase the quality of a medical education. So as you can see that MCI and MD degree was given as a starter. It was like to regulate and to initiate, but DNB was actually started to uplift the medical quality, and this was started. Now the major change came in 2019 when the parliamentary board gave very important verdict, and it came as a bill about MD DNB equivalence. So initially DNB was not considered as a equivalence or inferior to MD, but after this bill was passed on 8th of August 2019, it said that DNB qualification from institute with minimum 500 bed shall be equivalent in all respect to the MDMS, and all for other cases, means the hospitals which had less than 500 bed, additional 1 year senior residency in a MCI recognized medical college shall be required for equivalence. So if you have done your DNB from a hospital which has 500 or more bed, so you will be as considered equivalent to MD. So that is, you should take into consideration while taking admission. Also, even if you are getting admission in a good hospital which has a less than 500 bed, you will need to do a 1 year of senior residency additional to get that equivalence. Also, High Court also had said that DNB hospitals are teaching hospitals, and DNBs trained in these hospitals can hold teaching posts, because a lot of DNB candidates, even they want to go in a medical college and work as a teacher. So definitely there are a lot of DNB candidates who are working as a teacher and academician already. So these I just wanted to show you the what were the important milestones. Now if you compare MD versus DNB head to head, so if you compare about the joining criteria, about the medical college and the institute that are running MDMS or DNB, about the academic activities, about the thesis work, thesis guide, about the clinical activity, equivalence, experience, teachers, teaching skill and practitioner skill, you will realize everything is same for MDMS and DNB. The only difference is about the final exam. For MDMS, your final exam, your theory and your practical happens at the same time, like just a gap of few days. But for DNB, you have to pass your theory to become eligible for your practical exam. So in MDMS, when you give your practical exam, you don't know whether you have passed your theory or not, and it does not matter. In DNB, when you have to get your result of theory exam, and then you will be allowed to take practicals. Also in MDMS exam, you have your internals, and it usually, and not usually, it happens actually in your own hospital where you have completed your MDMS. DNB, you get a very different, like a neutral exam center, that you can get any exam center throughout India. So that is actually a major difference between DNB and MDMS. Otherwise everything else is same. There is a very beautiful review article written in Innovate Journal of Medical Sciences. So you can actually go through this article if you want to know more about it. So what is in layman's term, like what are the established opinions? So if you think about, like normally, like this is what I showed was a scientific, but if you think like in layman's term, or what is a normally established opinion, that MD brings your tag. MD, there is a tag attached to MD, and DNB is always considered as an alternate option. Like if you are a DNB candidate, a lot of people will say that you took DNB because you did not get MD. MD has a difficult entry, DNB has a relatively easy entry, because DNB you can get at a lower rank as well, but MD has an easy exit and DNB has a tough exit exam. Social recognition, that it is said that people usually prefer MD doctor. DNB, yes, recognition was earlier a issue, but now recognition is not a major issue if you ask me. So if you look for the preference in the job, the usually MD get the preference, and DNB definitely faces competition from an MD holder. And as MD hospitals are usually government hospital and bigger, they have a better patient exposure and procedure experience as compared to the DNB, because DNB are usually a corporate hospitals, and when the patient pay more for their procedures and everything, they want it to be done by the experienced hands. So that is also a limitation in DNB hospital. Also DNB people, as they are working in a corporate hospital, so they have a better patient interaction and work ethics. Also DNB is considered to have a better recognition abroad. And also the major issue about the bond, a lot of MD, like most of the states in India, like Rajasthan has a 5-year bond for MD, like South Indian colleges have around 3 years of bonds. Also a lot of states have approximately 2 to 3 years of bonds. So that bond issue is not there in the DNB, which actually in a favor of DNB. Now what do experts say? As I said that this is what is the established opinion. So again quoting the same article, that many senior academicians, they consider DNB as equivalent or even superior to MDMS with respect to training, practiced ability, stating high standard and non-corrupt system in India. They also express that training skills sets vary in different institution, both in DNB and MD courses. Also some say that superiority of the DNB or MDMS by addressing its high standard, centralized selection procedure, tough exit examination, and increased recognition abroad, and they support the MD DNB equivalence. Also what they say, that requirement of additional experience was reasonable earlier in DNB due to lack of dissertation and thesis, but now DNB candidate also have to do the thesis. So there is no rationale for saying for having DNB DNB candidates needing additional teaching experience. So they say that like earlier there was no thesis in DNB, but now there is thesis in DNB, so you should consider it as a equivalent. So this is actually the expert opinion, and that this is what actually a major like a lot of people in India say. Now what is the problem? Like whatever I have been showing you in the previous slides, it's all says about the how DNB and MD are equivalent. Even some people say that DNB is superior due to because the quality have DNB candidates have been improving because of the difficult exit examination. So what are the problems? What is stopping student from taking DNB? So first is tag of MD. So it's always, it always come down to self. So this is what actually a difference between Apple and Samsung. So we know that Samsung phones are better, and they are in terms of feasibility, affordability, and user friendliness, Samsung is always better than Apple. But Apple comes with the brand, and everyone wants to have an Apple phone. So similarly like MD, no matter how many times we say MD and DNB are equivalent, even DNB is superior in some cases as compared to MD, but we actually look for a brand, and MD is now being an established brand, so it stops student from taking a DNB course. Also, salary given by the DNB hospitals is very less. Like some hospitals the range is 25 to 50,000 a month, whereas the MD hospitals usually offer from 55,000 to even like AIMS institutes, they offer more than 90,000 salary per month for a MD candidate. So that is also an issue. Now even if some student who don't have an issue with the MD tag or a salary, that is the most important thing that stops them is the passing rate. So there have been lot said about passing rate in DNB. If we look at the last 3 sessions about June 2020 session, you can see the passing rate in the all the major branches. So what you can see that what I will say on an average it's 60 to 80%, and I feel it's a very decent passing rate. If you look at obstetrics and gynecology, it have an excellent passing rate like 68%, 88.5, 89%. General medicine 85, 67, 73. General surgery 69, 84, 68. So you can see, I don't see it's a very bad passing rate. Earlier 25 to 30% of passing rate was considered for DNB, but I think now it's better. The students are studying more and they're getting a better results. But still the passing rate is a worry for some branches, like orthopedics had only 80% passing rate, ENT had 34%. Pathology also had lower passing rate, and pediatrics consistently have a lower passing rate. So it's like different branch wise, but I feel that we have to consider ourselves in a group where we should count ourselves in the students who are going to pass. Also what I will say that sometimes it is said that DNB in some peripheral hospitals, like very peripheral hospitals, you get DNB at a very low rank. So I feel this is my personal opinion that the student which the student who had this kind of attitude of not studying for PG exam as well, and now they have gotten DNB for lower rank. I'm not saying it for everyone, but few students. So if their attitude remains the same during the DNB residency, so you won't be surprised if they don't clear the residency. And I think that is a very important factor, that individual mindset and individual readiness for the exam should also be considered when you think about DNB. So I feel, my personal opinion, that passing rate should not be a major issue if you want to take a DNB. So coming to the important thing, that what is my opinion, what I think after all this discussion. So as per my opinion, DNB is a good alternative option if you don't want to waste a year and want to pursue the branch of your choice. So I will always say keep a branch always ahead. If you are not getting MD in your branch, but if you are getting DNB in your college, in a good college, take it. If you're not getting your branch and you have to compromise for your branch, then definitely you can think about dropping a year or writing another exam. If you ask me, when I took a drop because I wanted to go to study into AIMS, so my backup plan was DNB. I had told my parents, because after taking a drop, I had taken one drop already, but still I did not get a good rank in AIMS. I got good rank in NEET, but I wanted to go into AIMS. So my dad was not very much convinced. So I gave him assurance that if I don't get MD in AIMS, I will go for not MD but branch of my choice in AIMS. I will take a branch of choice through DNB. So that was my backup plan, and I think that is what you should tell yourself, that even if you take a drop, even if you don't get sometimes the things can go wrong, and if you don't get a branch of your choice, you should go for DNB in the same branch. Don't compromise on your branch just for the sake of college or degree. In view of changing dynamics, first movers advantage is the key if you're planning for a semi-urban and rural areas. See, the thing is, if you take MD in a state, suppose you are from, let's say you are from some North Indian state or a South Indian state, and you get a MD college in Rajasthan. Now Rajasthan has a 5-year bond, or any South college which has a 3-year bond. So you have to complete 3 years of your MD and 3 years of your bond. So total 6 years are invested. But if you take DNB, after DNB, you can directly come to your place. Like if you are from, let's say, Maharashtra, you can come to Maharashtra and you can start practicing, and you have that advantage because now, as I say, the things are saturating in cities, so you always have that first movers advantage. And if you take a drop and then you start your MD, then the guy who has already taken DNB and he is from the same of area that of yours, he's going to establish himself first. In a private practice, MD and DNB is not much a difference. I can tell you that with my experience. And if you are someone who had decided for super specialties, that is, you are taking a medicinal branch like medicine or surgery, and you are sure that you are going to do a super specialization, then definitely go for DNB, because nowadays, because the DNB exit is difficult, lot of DNB candidates are actually cracking super specialty exam more than MD students. Only thing I'll advise that whenever you go for a look for a DNB seat, look for a good city and established hospital. Like I have contrast of opinion for this. Actually, this thing I will always advise that look for a good city if you want to directly establish yourself. Like if you want to do a surgical branches. For surgical branches, always look for a metro city and established hospital, because you need cutting. You need to have a practice to acquire those skills. But if you are getting a medicinal branch like medicine, pediatrics, where the theory is more important, you can actually compromise on peripheral branches as well, because you can, whatever the deficiencies you can have, you can read a book and you can become master in that. But for surgical branches, that's not issue. For surgical, you need that exposure. Also, you have to consider the city you want to settle in, your family background, situation, and everything. Don't take decisions emotionally. Don't just listen to your heart. You have to use your brain as well. You have to see what is your parents saying, what is your scenario, where you want to settle. If you're getting MD like in a very peripheral college and where the bond is there, and after 2 years you feel like I won't be able to do a bond and I want to go home, and then all issues will be there. So don't be emotional and take a decision. And at last, what I will say is you have to convince yourself and not anyone else. So as I have shown you all the aspects of MD and DNB, and no matter how many times I say that DNB is equivalent to MD, or everything about that, at the end of the day, it is up to yourself. If you don't worry what people say, you are not worried, like that doesn't matter. If you are skilled, if you have that ability to perform well, and if you are ready to do the hard work, I will say definitely you will succeed as a doctor, even if you are a DNB holder or a MD holder. That is not an issue. I have seen the doctors who are just MBBS but who are doing much better than what MD doctors are doing. And lastly, about a few words about the diploma. So diploma, I consider it is a good option for those who wants to settle early, and you can practice as a specialist in semi-urban and rural areas. So if you want to someone who wants to settle down in a small city and you don't want to waste a year, because as I said, always take a first mover's advantage. Like I have seen places like even where I belong to, I have seen already established DCs like diploma in child health, and now they are doing much better than the MD pediatrics, because they have been practicing for so long, and also they offer their services at very less cost. And if you think you are someone like difference between MD and DCH is your MD is better trained for handling the emergencies. So if you are running OPD, the skill of a MD and DCH are not going to be different. But for the same diagnosis and treatment, like the patient of pneumonia, diarrhea, which are you going to address on the OPD basis, MD is going to charge 300 and DCH will do the same thing in 100 to 150 rupees. So obviously people are going to prefer, no matter how well they are, they're going to prefer a DCH doctor. So that's what I'm telling you, that don't think about that part. If you want to start early and want to settle down in a semi-urban area, you will definitely make a decent money if you do a diploma in diabetes, like diabetologist or something. You can definitely earn a decent money. Also, you get a good recognition because as a general doctor. Only limitation is the metro cities and higher profile jobs. You will have limitations, and when you have competition from in metro cities, you have a lot of competition, so that might be a problem. So guys, that's all I wanted to tell about MD, DNB and diploma, and I hope it helps. So I wish you all the best and take care.